maybe in the past however many years. So not very common anymore. Now we just use latex-free plastic material. For number 3, guidelines that we should use when we're working with someone who has an artificial airway. We want to report to the nurse if there are any changes, if there is any issue with the tubing, like it comes out, any changes to vital signs. We want to watch for any anxiety or agitation, like biting or tugging at the tube. Provide oral care. Find some other way to communicate since verbal communication is not going to be available. And be very supportive and reassuring. Even if the resident is not communicating, they can still hear you. Under section 8, true or false, number 1 is false. 2 and 3, true. 4, false. 5, 6, 7, and 8 are true. Under section 9, crossword puzzle on 2 pages again. Starting with the across questions. Across number 3 is straw. Number 4, call lights. And number 6, sedative. For the down questions, who wants to tell us what they got for 1, 2, and 5? Samantha, is your hands up for this one, or was it?
It can be.
Okay.
Okay. For 2, I got speak. 5 down, I got lungs. And 1, I got pressure injuries.
Good. Thank you. And then for section 10, true or false, number 1 is true. 2 and 3, false. 4, 5, 6, and 7 are all true. For section 11, multiple choice 1, A. 2, C. 3, D. 4, C. And 5, B. Any questions from chapter 22? All right. Moving on to chapter 23. Starting on page 137. Section 1, true or false question. Number 1 is true. Number 2, false. 3, true. 4, false. And 5, true. Under multiple choice, number 6 is A. Number 7, B. 8, E. 9, D. And then on to the next page, number 10, A. Number 11, C. Number 12, E. Under section 2, multiple choice number 1, you could have circled either C or E or both. Both of them would work for that scenario. And for number 2, also could have circled C, E, or both. Both of those would work for that one. For number 3, B. 4, D. 5, D. Oh, does someone have a question?
Oh.
I was like, whoa, somebody said something. Number 5, D. Number 6, B. 7, B. 8, C. out numbers 1 and 2, and then on the next page, number 3. That's all you need to do. For section 4, fill in the blank. Number 1 is bathe. Number 2, pain. Number 3, alignment. Number 4, listening. Number 5, touch. 6, avoid. 7, hearing. 8, privacy. And 9, religious. Section 5, short answer question 1. Who wants to tell us 3 legal rights that have to be honored when we're working with residents who are dying? Yeah, Valerie?
I got the right to refuse treatment, the right to have visitors, and the right for privacy.
Good, thank you. And then number 2 will vary, so as long as you filled it out. For section 6, multiple choice 1, B, 2, D, and 3, B. And then number 4, that is called palliative care. So remember, palliative care and hospice are different. A lot of times people use those terms interchangeably. The main difference, though, is that somebody on hospice usually has 6 months or less to live, whereas somebody on palliative care maybe doesn't necessarily have a time frame. Short answer question number 5, guidelines that are helpful when you're working in hospice. Be a good listener. Respect privacy and independence. Be sensitive to each individual's needs. Be aware of your own feelings. Recognize that it can be stressful. So take good care of yourself. Take your breaks. Find something that helps you to relieve stress or to initiate relaxation. For section 7, signs that someone is approaching death would be number 2, 3, 4, 7, 8, and 9. On to the next page. Section 8, true or false. Number 1 is true. Number 2, false. 3, true. 4, false. And 5, true. Section 9, who wants to go through multiple choice 1 through 4? Yeah, Rebecca?
For 1, I got C. 2, I got A. 3, I got B. 4, I got A.
Good, thank you. And for section 10, number 1 is false. Number 2, true. 3, false. 4, 5, and 6, true. 7, false. 8, true. And 9, false. Any questions from chapter 23? No? All right. Moving on to chapter 24. My dog has just realized that I'm inside the window that he can see through from outside. He's like, oh. Animals are so funny sometimes. They're like children. They're like discovering things, and it's really entertaining to watch. All right. So a lot of this is practice for you, so like an employment application and such. So a lot of these sections, as long as you filled them out, you're good to go. We'll go through the ones that have answers. So section 1, true or false, number 1 is false. And then 2, 3, 4, and 5 are true. For section 2, 1 and 2 are false. 3 and 4 true. 5 false. 6 true. Section 3, as long as you filled it out for practice. On the next page, section 4, appropriate actions for job interviews would be number 2, number 4, number 5, number 8, number 9, number 10, and number 14. Couple of pieces of advice for you. A lot of times people go to job interviews, and I know this from experience. I used to interview people when I worked in clinic, and I used to hire people. And a lot of people will come in and they sit there and answer all the questions that they're asked. And then when they're asked if they have any questions, they say, no, don't do that. Ask if they didn't tell you what shift or what hours or part-time, full-time, maybe what the benefits are, what the hourly pay rate is. Ask those things. You should also always ask when you're going to hear back. Are you going to hear back about whether or not you got the job tomorrow, next week, next month? So ask those questions. That shows not only that you are actually interested in the job, but that you're taking some initiative, asking those questions if they don't tell you. So make sure, ask questions if you have them, things haven't been answered, and it makes you look better. Hopefully that makes sense if you're asking those questions and you're actually invested. For section 5, a job description is essentially an agreement between you, the employee, and the job or the employer. It tells you what your responsibilities are, what tasks are expected of you. It includes what skills you need to perform that job. And it acts kind of like an agreement, as in, this is who you would report to. So this is like your supervisor. This would be your salary range. This is what we expect you to do. And if you agree to that job description, then your facility will move forward with you. If you don't look at the job description and you agree, then you don't really have the ability to stand up for yourself in the future if you're asked to do something that maybe wasn't in your job description. So please make sure to read your job description. If your job description ever includes some sort of wording like, and any other assigned tasks, please figure out what those are. Don't just say, okay. If it says other assigned tasks, I want to know what other assigned tasks I might be responsible for before I sign up for a job. So please ask. For number 2, the job description protects the employer and the employee because the facility can't basically assign you additional tasks that weren't in your job description without first asking you. It protects you from being fired for not doing something if it wasn't in your job description. You also can't say you didn't know what you were supposed to do, right? Because you read through the job description. So you can't tell your employer you didn't know what your tasks were because those were given to you. Decreases the chances of misunderstandings. It also can be used to pull up in the event that there's an issue, some sort of disagreement as far as what your job duties are or who you report to or that sort of thing. For section 6, multiple choice number 1 is D. Number 2, C. Number 3, A. And number 4, A. Section 7, numbers 1 and 2 are H for hostile. Number 3 is C for constructive. 4H, 5C, 6 and 7H, 8 and 9C, and 10H. For section 8, fill in the blank. Number 1 is 2. Really important to give that notice because Essentially, who suffers if you don't give notice is the residents. It's not really the employer, right? They're going to look for someone else to do your job, but it's the residents that are suffering and all of your other coworkers as well. So please make sure you give 2 weeks notice or more if you have more notice you can give. For number 2, that is your past supervisors or employers. So important to maintain a positive relationship with them so that if you are applying for jobs in the future and you need a reference for someone who can vouch for your work abilities, that you have someone to write down. And for number 3, be responsible. For section 9, multiple choice number 1, OBRA requires at least 75 hours, so that is C. Remember when we were talking about this in the beginning of class, I said 75 hours is not a lot of training, so be glad that you're in a state that requires more training. For number 2, OBRA requires 12 hours of continuing education annually. California requires more. For number 3, C, competency evaluation. For number 4, B. And number 5, D. On to the next page for section 10. Number 1 is false. Number 2 is true. 3, false. And 4, true. For section 11, like I said yesterday, important to figure out maybe what situations cause you stress, how you react when you're stressed, and then different stress management, which is number 6 on section 12. So what you're going to do in the event that you become stressed or start to feel like you're getting burnt out. So under section 12 for multiple choice, stress is B. It's both a physical and emotional response. Number 2, C. 3, B. 4, D. And 5, B. Anything you wrote down in number 6, that's the stuff I would transcribe onto a little sticky note and put it somewhere that you look at frequently. For section 13, as long as you answered this one, just trying to give you some insight on relaxation techniques. For number 2, same thing, as long as you filled that one out. And then we'll go over section 14, but one piece of advice I want to give you that I don't feel like this chapter gives you very well is when you are applying for jobs, like I said, in this day and age, healthcare workers, there is a high need for us, right? So back when I started in healthcare, it was a struggle to get a job. I can't tell you how many different places I applied for my first job and how many different places I didn't even get an interview. So in this day and age, there is much more demand for healthcare workers. Therefore, there might be many more job opportunities for you. So as you go around and you apply to different places, I would stress the importance of, if you know someone who works at that facility, figure out how the facility is. Do they like it there? Are they always short-staffed and they don't like it? Also, when you're applying, when you get interviews, if you're thinking about taking a job, ask if you can do what's called shadowing. So what shadowing is when a potential employer has you sign HIPAA forms and then allows you to come in and observe what goes on for an hour, 2 hours, an entire shift if you want. It's not paid. So it's just essentially making sure that what is going on in the facility is something that you are wanting to get into. One red flag would be if the employer does not let you shadow. Another red flag would be if you shadow and there's unanswered call lights, all of the nursing assistants are frustrated with one another, not working together. Maybe residents aren't satisfied. Maybe they're short-staffed. Those sorts of things can kind of tell you maybe don't look at that facility for employment, maybe look somewhere else. So if you are able to shadow even just for a couple of hours, it can give you good insight before you get hired and realize that maybe you made the wrong choice. So that would be my advice to you. Like I said, some facilities might say, no, you can't shadow. If it were me, that would be a red flag. Why can't I sign HIPAA forms that I'm not going to talk about anyone outside of this facility and shadow before I get hired? Right? Why can't I see what's happening before I actually sign up to do it? So that would be my piece of advice for you. Also, if you apply multiple places, interview multiple places, and you're getting offered multiple jobs, figure out which one works best for you. The pay, the benefits, the hours, days of the week. Some jobs are on like a rotation, so it's like 4 days on, 2 days off for full-time. So does that work for you? Or is there maybe a job where you're working, Monday through Thursday, and then you have weekends off? Maybe you have kids, and that works better. So know what different benefits each job has for you, and that will help you to compare and to pick one of those jobs to take. Any questions about that? All right. So we'll go over section 14. Short answer question 1. Does anyone want to share anything they wrote down that they learned that was surprising or exciting to them? No? Nobody learned anything? You're all going to do really well on your state exam if you didn't learn anything. You already knew it all. Yeah, Melanie?
So I joined this program because my dad, he's a stroke survivor, so he has like a trach and a feeding tube, so I want to know how to take care of him better. And for the last like 5 months, when I give him foot massages, I've been putting lotion in between his toes. And so this is the first time I've heard that I shouldn't be doing that, and I should be like wiping it out. So that was like my biggest takeaway, probably. It's something very small, but made a big difference.
Yeah, even the little things, when you learn those things, it's like, who knew, right? And maybe some people don't know, and you can be like, hey, you're not supposed to put lotion between the toes.
Yeah,
If you're working with other people that do it. Good. Thank you for sharing. Anyone else want to share anything that they learned? All right, then we'll move to number 2. So things that you're looking forward to doing when you start working as a nursing assistant. Anyone want to share that? Is anyone looking forward to working? Yeah, Maricela, you are?
I'm been a caregiver for many years, and my CNA Aspire. So I'm looking forward to work with hospice.
Good.
I have worked with hospice before, and it's very rewarding. Like to be able to help people, and they're in their last. I'm gonna feel emotional. I have lost people too. So I think it's a good place for me to be.
Good. Yeah. I think that people don't see the importance of hospice care. If you think about, babies are born and they come into this world and there's hundreds of people that want to see them and they're all excited, right? But when people leave the world, I think that that's really important as well for people to be around that person and to provide support and comfort for that person. So good. I'm glad you have a special place in your heart for hospice. That's awesome. Anyone else want to share what they're excited for? Yeah, Melanie?
I'm excited to meet residents and get to know them, and just getting to be there for them.
Good.
Kind of like what Maricela said.
Yeah.
Bond with them and being there for them, supporting them.
Yes. You'll hear really honestly some of the best stories from residents. like quote unquote the good old times is all of the stories I used to hear about. It's like, wow. One of the gentlemen that I took care of when I did home care, he had a lot of past life experiences, and one of his favorite experiences to talk about was they had a little trolley that they had built. He was a member of the 40 at 8. If you're not familiar with what that is, you can look it up. But essentially, he was a member, and they had a little trolley that they built, and the trolley did like all of the parades, and they would drive the trolley. It was actually like street legal, and so they would drive it from wherever it needed to go to wherever it needed to go next. And some of his experiences driving the trolley always made me laugh. Also, he used to tell me about, back when I bought my house, it was less than you paid for that car. It's like, yeah, I definitely believe you. I'm sure that that's the case, and your house is essentially larger than most houses than you could buy today for, 10 times the price. So all sorts of different stories and experiences that you'll hear about that are really interesting. You can really learn a lot from the older population if you just listen. Anyone else want to share, or are there any questions from chapter 24? All right. The procedure checklist that you're probably seeing on the next page, those ones are great, but for the purposes of your state exam, I want you to use the CNA Skills Handbook that's in your Resources tab. Those skills are specific to how you will be checked off for your state exam. And then there is a practice exam in the back somewhere. Starting on page 199. Yes, 199. You will get to take the practice exam online, so you don't need to worry about the one in this workbook. So now that this lovely thing is filled out and you are finished with it, please take a permanent marker and write your name, like right here. That way, when all 15 of you bring these in to clinical on the first day, they don't get confused. So make sure your name is on it. That way, when you turn it in, we can get it back to you. All right, so put that somewhere where you're going to remember it. Next Wednesday, seems like so far away, but it's coming up quickly. And then just want to make sure Kylie has not joined us. Kylie? No. All right. And then other than that, we will go through a review PowerPoint, and then we will talk about what to expect for the future. Any questions before we start the review? All right. I will post this review PowerPoint after class into your Google Classroom, so you will be able to see that. I don't post it before because it has all the answers in it. So I want you to give it your best shot off of your memory before you actually get to see the answers. All right, so how this works is I'll share the PowerPoint on the screen. We'll read through the question, and then I'll let you read through the answer options, and then you can feel free to unmute yourself to just say whatever the answer is that you think it is. If you want to type it in the chat box, that works as well. And then we'll go with the common answer and see if it is correct. So the answer will come on the next slide. So don't be shy. If you get the answer wrong, guess what? You'll learn. You'll get to learn the right answer. All right, so here's the first question. What is long-term care? B, A, B, B, B. All right, I think we're going with B. So is long-term care B? Yes, it is. So 24-hour, remember, around-the-clock care that is given in a long-term care facility. What are activities of daily living?
A.
A. Looks like everyone agrees on A. Good. So those are all of the daily things that we would do: bathing, dressing, grooming, brushing our teeth, walking, eliminating, eating, etc. What's the difference between Medicare and Medicaid? C, D, C, D.
C.
Lots of C's and D's. What are we going to go with? I think there's like an equal number of C's and D's. Let's find out who's correct. So it is D. Remember that Medicare is for anyone 65 or older, and it includes parts A, B, C, and D. And then Medicaid is usually for low income or some sort of disability. How many milliliters are in 1 ounce? A. A, good. So there are 30 milliliters per 1 ounce. Nursing assistants are not allowed to do what? C. C. Looks like everyone agrees on C. That is correct. Remember, nothing sterile, no insertion or removal of tubes, no tube feedings, and in most states cannot give medication. What does the term scope of practice mean? A. Looks like the general consensus is A, which is correct. So tasks that healthcare providers are legally allowed to do by federal law and the state that they work in. True or false? Nursing assistants delegate tasks to other healthcare professionals. B. Looks like everybody agrees on B, and that is correct. Remember that delegation comes from someone who has a higher scope of practice, so typically the nurse, to someone who has a lower scope of practice, typically the nursing assistant. Residents' rights specify how residents must be treated in a facility. Which of the following is not a resident right? C. Good. Looks like we all agree. So the right to experience negligence, no, the right to be free from negligence would be more correct. What is a mandated or mandatory reporter? C. Looks like everybody agrees on C. Good. So that is someone who is legally required to report any suspected or observed abuse or neglect due to their regular contact with vulnerable populations. Examples of protected health information, or PHI, would include what? A, D, D. A or D? Dun, dun, dun. Which one is it going to be? It is A. And this one sometimes trips people up. The reason it is not D is because typically we can tell someone's marital status just by looking at the ring finger on their left hand. So many people, I would say most people who are married, wear something on the left hand that would indicate that, right? So they have a ring. So that it would be considered public information because you can tell just by looking at someone's hand, even if you don't talk to them, their marital status. So that one is not considered protected health information. All of the others, like their name, their address, their date of birth, their phone number, their social security number, medical record number, all of that stuff is protected health info. So that's the only reason that D is not correct. What's the difference between verbal and nonverbal communication? C, C, C. Looks like everyone agrees on C. Good. So nonverbal communication doesn't involve any written or nonverbal communication does not involve the use of written words and spoken words, but verbal communication does use written and spoken words. So remember, our nonverbal communication is usually body language. If a resident consumes a fourth of their lunch, what percentage of that lunch would they have eaten? C. Looks like everybody agrees on that one, and that is correct. So 25%. Remember, 100% would be the whole thing. So a fourth of that would be 25%. All right, fill in the blank. Blank information cannot be observed by the nursing assistant and instead is only reported by the resident. Blank information is based on the nursing assistant's observations, what they see, hear, touch, or smell. B, 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 good. Looks like everyone agrees on B, and that is correct. So subjective comes from the subject or the resident. Objective can be observed by us, the nursing assistants. It is 2:00 p.m. and your shift is starting. What time would this be on a 24-hour clock? A, looks like everybody agrees. Good. So remember, if you add 12 to 2:00, that gives you 1400. All of the following are incidents, which is an accident or unexpected event, that would require the nursing assistant to fill out an incident report, except for what? Lots of B's, a few A's. Looks like the majority is B, and that is correct. So A does require an incident report. Falls, injuries to you or the resident, also any exposure to blood or bodily fluid does require an incident report. If the resident doesn't eat their meal, just reporting that to the nurse, letting them know, hey, Mrs. Smith didn't eat her dinner today. I offered her something else and she declined. That is all you need to do for that. We don't need to fill out an incident report. A resident has had a CVA or a stroke, so they may have a weaker side of their body. The nursing assistant should refer to the weaker side as what? C, 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 a B, C. Looks like majority is C, and that is correct. So we can refer to that as the weaker side, the involved side, the affected side is okay as well. The nursing assistant goes in to get the resident ready for mealtime and the resident is angry. What should the nursing assistant do? D, D. Looks like everyone agrees on that one, which is D, and that is correct. So try to figure out what's causing the anger. See if maybe one of their basic physical needs isn't met. Maybe if it's mealtime, they're hungry. Maybe they're hangry. You're going in to get them for mealtime and they're angry, and you're like, I'm here to take you to get your meal. That might help. So never argue. Try to stay calm, figure out what the cause is. If you can't get them to calm down, you can't determine what the cause is, you can always leave and come back later. So maybe go get someone else, take them to mealtime, and then come back and try again. Healthcare associated infections, or HAIs, are what? B, 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 D, B. Looks like the general consensus is B, and that is correct. So that is a type of infection that a resident gets as a little extra plus during their stay at a healthcare facility. So they come in without an infection, they're in the facility, and due to some lack of infection prevention, they get an infection in the healthcare facility. Many facilities nowadays do not get reimbursed for healthcare associated infections. So for example, if the person comes into the facility and they need a catheter, and the nurse inserts the catheter but doesn't follow the sterile procedure, and the resident gets a urinary tract infection, then the hospital does not get paid for the care of that urinary tract infection at all. So none of the antibiotics, maybe if there's an additional stay, none of that is going to be covered. So that is all out of pocket for that facility. That facility has to pay for all of that. So what is D? An infection that healthcare providers are susceptible to working in a healthcare facility. There's not a specific term for that. There's not any one specific infection that we would be susceptible to. As long as we're following infection prevention measures, we're not any more susceptible to anything. So as long as we're taking all of those precautions that we talked about with standard precautions, and then also if there's any transmission-based precaution that needs to be followed, then we should be fine, should be well protected. What is the abbreviation for as necessary? You'll see this one a lot. D, B, D, B, D. B and D. Looks like they're pretty equal. So B stands for the abdomen. So the correct answer is going to be D, which is PRN. So if you see something in the care plan that says ambulate the resident PRN, that just means whenever they need to ambulate, whenever they need to get up and walk. Why are elderly people at a higher risk for infection? B. Looks like all of these are B. Good. So remember, as we get older, everything slows down, immune system becomes weaker, which puts them at a higher risk for infection. Standard precautions involve treating all bodily fluids as if they were infected. Which of these is not considered to be a body fluid? C. C. Good. Looks like everyone agrees on C, which is sweat, and that is correct. This one has lots of long answers. What are all the requirements for a successful renewal of your California CNA license? There may be more than one answer. C. Are there any others that would be accurate as well? C and D. A. A and C. B, one of each. So this one is a little bit tricky. Renewal fee, unfortunately, is more than that, so that one's not correct. But you need to maintain a clean criminal record. If you have a criminal record, your ability to be licensed and to be taking care of vulnerable populations is very slim. You need to work a minimum of 1 shift or 8 hours providing CNA services in a facility for compensation, meaning you need to work 1 paid shift. And then C, you need to have your continuing education units. Remember, California requires more than federal, so it's 48 hours total. You need to have 12 of those 48 hours completed each year. So you can do, for example, 12 in year 1 and finish up the rest in year 2. What that prevents you from doing is doing all of them at the last minute. So they don't want you to do 48 of them 1 month before they're due, because the chances of you actually learning something from that are pretty slim. So you have to have at least 12 each year, and then the rest you can distribute however you would prefer. And there's information in your modules on how to obtain CEUs. We do offer CEU classes at VTI, so if you wanted to take your CEUs that way, you can. There are also some approved online programs as well. So you can get them from a lot of different sources. Sometimes your facility will even give you CEUs, so you could check that out as well. What is the correct statement regarding donning and doffing of PPE? D. Does everyone agree with D? A. A. Looks like the general consensus is A, which is correct. When you are doffing your PPE, the last thing you should do is wash your hands. So after you get everything off, wash your hands. If you have soap and water, great. If not, use an alcohol-based hand rub. True or false? Transmission-based precautions are used in addition to standard precautions. Lots of A, some B. So this one is true, so that would be B. Remember, our standard precautions don't ever go out the door. We always use our standard precautions, and then if there are any transmission-based precautions on top of that, then we would apply those as well. All of the following are guidelines to help prevent falls, except for what? C. C. Looks like everyone agrees with that. And that is correct. Bed wheels should be locked, not unlocked. Oxygen is combustible and flammable. Special precautions when a resident uses oxygen include what? D. D. Looks like everyone agrees on that one. And that is correct. Any potential fire hazard should be removed from the room. This one gets people. Read through all the answers before you answer. What is a restraint? A, B, A, B, 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 Good. Looks like most people are saying B, and that is correct. So it can be both a physical restriction and or a chemical restriction of voluntary movements or behaviors. All right, some math. So at breakfast, a resident is served 8 ounces or 1 cup of water, 8 ounces or 1 cup of coffee, and 4 ounces or half a cup of juice. How many milliliters of fluid was this resident served? C. Lots of C. Looks like everyone agrees on that one, and that is correct. So if you took the 8 ounces and you multiplied it by 30 milliliters, and then multiplied that by 2, and then added in the 4 ounces multiplied by 30 milliliters, it would give you a total of 600 milliliters of fluid that the resident was served. True or false? Proper body mechanics include holding the object away from your body and using the muscles in your back to lift. B. Good. Nobody said A. Yay. That is false. Do not do that. That's going to result in a back injury. Hold the object close to you and use the muscles in your legs to lift. Cardiopulmonary resuscitation, or CPR, is used when a resident's blank or blank have stopped working. A. Looks like everyone agrees with that. That is correct. The heart and lungs. Signs of a myocardial infarction or heart attack do not include what? This one gets people too, so read through all of them. A and D, D, A, D. I see more of the answer D, which is correct. So when someone's having a heart attack, think about what's happening. So the blood supply to the heart muscle itself is blocked. So their pulse is usually weak, hard to detect, and irregular. Heart's not beating in a normal manner. So it's not going to be stronger. You're not going to feel it more than you typically would. It's going to be weaker. You're going to have a harder time detecting it. Medical term for you. What is epistaxis? B. B. Good. Looks like everyone agrees with that. And that is correct. That is a nosebleed. The acronym FAST is used when someone is potentially having a stroke. What does each of those letters stand for? What are we looking for? A. Looks like everyone agrees on A. That is correct. So we're looking at their face, symmetry, arms for symmetry, speech, make sure it's not slurred. And also remember, time is really important. If you think that they're having a stroke, letting the nurse know so that we can get them the care that they need can help to prevent them from having any lasting effects. So the quicker they get the care they need, the less likely they are to have lasting effects. And someone once asked me, well, what happens if I think that they're having a stroke and I tell the nurse and they get sent to the hospital and they weren't having a stroke? Well, good. I'm glad they weren't having a stroke. Better to be safe than to be sorry, right? So even if you think they are and they weren't, you don't need to feel guilty or bad about that. You got them the care that they needed based on the symptoms that they were having. What does the abbreviation BID mean? D, A, D, D. Good. Looks like the majority is answer D, which is correct. BID means 2 times per day. So if you see instructions in the care plan like provide oral care BID, that means 2 times per day. That doesn't give you an exact time, right? It doesn't say that you have to provide oral care at 8 a.m. and 8 p.m., just means twice per day. According to Maslow's hierarchy of needs, blank needs must be met first before blank needs can be met. A, D, B, A, D, A. Majority says A, and that is correct. So remember all those physical needs: food, fluid, bathroom, rest, freedom from comfort, activity. All of those things need to be met before we can meet those psychosocial needs or those social emotional needs. Why is it important for the nursing assistant to provide holistic care to all residents? B, B, B. Looks like everyone agrees there. And that is correct. We want to ensure that we are meeting their physical needs, their social, emotional, psychological needs, not just addressing those physical things, right? That's going to be really awkward if you're not talking to them or engaging with them to help with the rest of those needs. Guidelines for respecting residents' sexual needs include all of the following except what? D. Good. Looks like everybody agrees, and that is correct. So if there is a situation that you encounter in your facility between consenting adults, you would just provide privacy and leave the room. Of course, if your facility does not have consenting adults, you would follow your facility's policy. What is the term for the study of health, wellness, and disease later in life? C. Looks like everyone agrees with C. Good. So that is geriatrics. Fill in the blank. When blank occur or occurs, muscles become weak, decrease in size, and begin to waste away. When blank occur or occurs, the muscle or tendon shortens, stiffens, and freezes in position. C. C. Good. Looks like everyone agrees with that, and that is correct. Atrophy and contracture. How often will you have to renew your California CNA license? B. B. Looks like everyone agrees on B, and that is correct. Hopefully you picked that up from the previous question. So every 2 years you will need to renew your license. True or false? The peripheral nervous system includes the brain and spinal cord. B, B, A, B. All right. It's pretty equal between A and B. So the peripheral nervous system is everything but the brain and spinal cord, so that one is false. The central nervous system is the brain and spinal cord. So central, keep in mind in the center, we've got our brain and spinal cord. And then everything else is the peripheral. So that's one way to remember it. Normal changes of aging on the circulatory system include all of the following except what? C, see. Good. Looks like everyone agrees. And that is correct. Blood flow, unfortunately, circulation decreases. If the resident is in a semi-seated position on his back, the resident's head and shoulders are elevated and the spine is straight. What position is this resident in? C, D, D, C, D, D. Looks like a majority are saying answer D, which is correct. That would be the semi-Fowler's position. It is not C because Sim's position is a left side-lying position with the upper knee flexed. A draw sheet is used to prevent blank of the resident's skin. B. Looks like everybody agrees with B. All right. So shearing, remember that's when the skin and the bone go in opposite directions, causes skin breakdown. A transfer belt or gait belt, as it's also called, should be placed around the resident's what? D. Looks like everybody agrees with that, and that is correct. It goes around their waist. True or false? If a resident falls during a transfer or while walking, the nursing assistant should support the resident and lower them to the floor. A. Good. Looks like everyone is agreeing on A, which is correct. Remember, we don't try to catch them, but we do try to assist them to the floor. To ensure safety, at least blank nursing assistants should be present for resident transfer using a lift. B. Good. Looks like everyone agrees with that, and that is correct. At least 2. You can have more if you need them. What is the abbreviation for before meals? B. Looks like majority says D, and that is correct. So AC means before meals. So if you had indication in the care plan to ambulate resident AC, get them up and walk them before mealtime. What does the term baseline mean? D. Looks like everyone agrees with D. That is correct. So these are vital signs taken when someone is admitted to a facility that we can use for comparison to any future vital signs that are taken. The lithotomy position is most commonly utilized for assessment of what? Remember, we talked about these with physical exams. B. B. Good. Looks like everybody agrees. And that is correct. That is typically used for female examination. What is OBRA's required range for temperature in a long-term care facility? And we're talking about like the main facility areas. A, B, A. All right, majority is saying A, and that is correct. So OBRA requires the main areas of a facility to be between 71 and 81 degrees Fahrenheit. They don't have any set temperature range for resident rooms. So if residents want to change the temperature in their room, it does not have to stay within that range. A resident is unable to fall asleep, and once they do fall asleep, they have trouble staying asleep. What would be the term for that? D. Good. Looks like everyone agrees with answer D, which is insomnia, and that is correct. Where is the resident located when the nursing assistant is making an occupied bed? A. Good. Looks like everyone agrees on A, and that is correct. The resident is occupying the bed. That's why it's occupied. So they're in the bed. If a resident is lying in a supine position, what bony prominences would need to be protected due to a high risk of pressure injuries occurring? D. Looks like everyone agrees with answer D, and that is correct. So supine position would be lying on the back, so the back of the head, the shoulder, the elbow, the buttock, the sacrum, which is the base of the spine, between the legs, and then also the heels would all be at risk for breaking down. Which parts of the body should be washed every day, even if the resident is not getting a full shower or bath? B, D, B, B. Looks like the majority is B, and that is correct. So their face, their hands, their underarms, and the perineal area. All right, so this one says, what should I do if I fail to meet my renewal requirements for my California CNA license? I will warn you, the answer is not A. Please do not select A. C? Good. Looks like the majority of the answers are C, and that is correct. So a little explanation here. Whenever you're interacting with the state in any means, do not ever just do nothing. They will not take care of anything for you. They're not going to automatically renew anything. They're not going to allow you to just reactivate your license if it expires. So if you realize that you have not completed your CEUs, for example, you want to contact the California Department of Public Health before your license expires. You want to inform them that you're not going to meet the renewal requirements and request a reactivation of your license. With that, you do have to retake your full state exam, written exam, and skills exam. If you do not contact them and your license expires, what you will have to do is retake your entire training and your state exam. So if you realize that you aren't going to meet the requirements, it's best to contact them so that you just have to do the state exam again, versus not contacting them and letting your license go and then having to join me for training all over again. So try to keep up with your continuing education units. Use the resources available to you. So like I said, we offer CEUs at VTI. Also, we offer, which you saw in your modules, a place to keep track of your CEUs. It's called SUMA. You can make an account and keep track of all of those continuing education units there so that you know how many you have, how many you need to do, etc. So try to stay on top of that. True or false? Nursing assistants can cut residents' fingernails and toenails no matter what facility they work in. B. Good. Looks like everyone agrees with answer B, which is false. Usually it's the nurse doing that. So know your facility's policy. An electric razor is a great option for residents on blood thinning medications that are at risk for bleeding, but it's important to note that electric razors cannot be used near blank or when blank is or are in use. C. Good. Looks like everyone's agreeing on C, which is correct. Should not be used with water. Also should not be used if the resident is using oxygen. What are the 5 different sites where you can take a temperature? C. Looks like majority is C, and that is correct. So via the mouth, the rectum, the armpit, the ear, also called the tympanic, and the temporal artery. What is the normal pulse rate for an average adult? D, A. Looks like majority answer is A, and that is correct. So 60 to 100 beats for your average adult is normal. Remember that for children, pediatrics, the number for the normal is going to be higher. Systolic blood pressure is the blank number of the blood pressure and is measuring the heart while it is blank. C. Good. Everyone agrees on C, and that is correct. The systolic is the top number, and remember the top number is higher because it is measuring the heart while it's working. In addition to checking a resident's temperature, pulse, respirations, and blood pressure, blank is another important vital sign to check. D. Good. Looks like general answer is D, which is correct. Pain is another important vital sign to check. True or false? If a warm or cold application is left on the resident's skin for too long, it can negatively affect the skin. A. Good. Looks like everyone agrees on A, which is true, and that is correct. True or false? It is okay for the nursing assistant to lower the IV bag below the side of the IV while changing the resident's clothing. B. Good. B, false is correct because remember gravity, so we never want to lower anything below the level of the actual device. So for the IV, don't want to lower the IV bag below the IV site. For the catheter, you don't want to raise the bag above the level of the bladder because it's going to cause whatever contents we're trying to get out to go back in, which puts someone at a risk for infection as well as other issues. What 6 nutrients does the body need for healthy growth and development? C. Good. Looks like everyone is agreeing with C, and that is correct. Those are our carbohydrates, water, minerals, vitamins, proteins, and fats. Output includes what? A, E, D, A, E, E, D, A. So technically those are all correct, but option E would be the best option because it includes all of the above. So make sure when you're reading through your questions, especially multiple choice, make sure you read through all the options before you pick one. So output includes urine, feces, emesis, wound drainage, and perspiration. Remember, some of that output, it's really hard to tell how much there is, like wound drainage or perspiration. We can't necessarily measure those things, but they are still included in that output. True or false? Urinary incontinence is a normal part of aging. B. Good. Everyone agrees. And that is very false. Urinary incontinence is a result of a disease process. It is not a normal part of aging. Hopefully everyone gets this one correct. True or false? Once my license expires, I can reactivate it at any time. Good. B, that is very false. You will have to join me again for CNA class and for your state exam. So make sure you keep up on your continuing education. When performing perineal care on a female resident, it is important to wipe how? C. C. Good. So very important to wipe from front to back so that we don't introduce any of the bacteria from the anal and rectal area up into the vaginal area. For the gastrointestinal system, specifically the stool, all of the following are signs and symptoms to report to the nurse, except for what? B, B, A, B, B, C, B. Looks like the most common answer is B, and that is correct. The reason that is correct is because when we're talking specifically about the gastrointestinal system and the stool, it doesn't have anything to do with urination. So we would want to report diarrhea, constipation, blood in the stool. But if we're going through report and we're going by system, we would include pain with urination under the genitourinary system, not the gastrointestinal system. When you're preparing to give a resident an enema or assisting the nurse, it is important to assist the resident into a blank position so that the enema does not have to flow against gravity. A is incorrect. D, good. D is correct. So anything, any procedure that requires anything going into the rectum, whether that be an enema, suppository, rectal temperature, we're always going to put them into the Sims position. A or an blank illness has a rapid onset and is usually short-term, treated immediately. A or an blank illness is long-term and treatment aims to manage symptoms. A, good. Looks like everyone agrees with that. Acute versus chronic. Common conditions of the blank system would include arthritis, osteoarthritis, osteoporosis, rheumatoid arthritis, and fractures. D. Good. Looks like everyone agrees with that. And that is correct. That would be the musculoskeletal system. The difference between paraplegia and quadriplegia is what? C. Good. Looks like everyone is agreeing on C, and that is correct. So paraplegia is paralysis of two limbs, which is the lower limbs. Quadriplegia includes more involvement. So the injury that caused the paralysis occurred higher up on the spinal column. So quadriplegia, quad meaning four, involves all four limbs and the trunk. Blank is a term that refers to a serious loss of mental abilities such as thinking, reasoning, and communicating. D. D. Good. Looks like everyone's agreeing on answer D, which is correct. That is dementia. Nursing assistants do all of the following to help a resident who is experiencing sundowning, except what? A. Good. Looks like everyone agrees with A. Never ignore the resident. That is not going to allow you to be successful. True or false? Dementia is not only hard for the resident, it can also be extremely difficult for family members and caregivers. A. Good. That is very true. Blank causes a person to have mood swings and changes in energy levels and their ability to function. D, B, D, D. Looks like general consensus is D, and that is correct. That is bipolar disorder. With this type of range of motion exercise, the resident does the exercise with some assistance and support from the nursing assistant. C. Looks like that's the consensus, and that is correct. Remember, AAROM, there's an A for the resident and an A for the nursing assistant. So the two A's together, active and assisted range of motion. So both parties are helping. A or an blank is a deep breathing device used to help residents take long, slow, deep breaths. It helps to expand the lungs and clear them of mucus, which helps to prevent infection. C, B, C, B. There's an equal number of both. So this was the thing that I showed you. We pulled up, it had a handle. It had a little measurement device. It had a tube for the resident to breathe in. And that thing was called an incentive spirometer. So that is the little device. It's basically one person use. So the resident's usually given one if they're in some sort of rehabilitation facility, and it is used to help expand the lungs, clear out the mucus, and help to prevent infection. What's a pulse oximeter used for? A, good. That is used to check oxygen saturation. All of the following are reasons a resident may require mechanical ventilation, except for what? B, good. So B, schizophrenia is a mental health condition. It is not a reason that someone would require mechanical ventilation. True or false? A terminal illness is a disease or condition that will eventually resolve. B, good. That is false. Unfortunately, terminal conditions will eventually result in death. A resident in your facility is receiving a special type of care that is aimed at relieving pain, controlling symptoms, preventing side effects and complications. What is this type of care called? D. Looks like everyone agrees with option D, and that is correct. So that is palliative care. Last question says, you are a nursing assistant working in a busy memory care facility. You know that in order to provide high quality care to your residents, it is important to also take care of yourself. What are some different things that you can do to help manage your stress? Any ideas? Take breaks, good. What else? Calming activities, eat, stretch, exercise, go for a walk, take a break, eat a meal that gives you energy. Good. So things like eating a nutritious diet, exercising, getting enough sleep, drinking water, those things are all the same for all of us. Other things like finding something that helps you to relieve stress or something that promotes relaxation depends on each individual. So finding something you enjoy, go outside, go for a walk, go, read a book in the park, watch a movie, do something crafty or artistic, go get a massage, listen to music. Those are all just ideas. Remember those little things I told you to write down on your sticky note? Write those down so that you know what those are for you, especially in a time when you need to reference them when you are under stress. Any questions about any of the review? Like I said, I will post that under the resources tab so that if you want to go back through it, you have time to do that. Other than that, we are just about finished. I just want to go over a couple of housekeeping things. So if everyone is okay with just like 5 minutes of housekeeping things, and then you'll be free to go instead of taking a break and then coming back, we will do that now. Is that okay with everyone? Yeah, okay. So housekeeping things. Your badge photo was due yesterday. So you should have submitted your badge photo. By submit, I mean email it into the school. Your presentation topic selection is due today. So if you have not already, make sure you have selected a presentation topic on the topic list. After today, that topic cannot change. Reason being is because we don't want, 15 presentations on the same thing. So once you select your topic, then that is your topic and you can get started on your presentation. As far as what to expect in the future, if you have missed any days of class, you will have makeup day. So if you look at your schedule, your makeup day is on Tuesday, the 30th. Everyone has Monday, the 29th off because that is the Memorial Day holiday. If you are not attending makeup day, meaning you're not logging on to the classroom like we are now at 9 a.m. on Tuesday, you have that day off. So study, do something unschool related, you have the day off. Wednesday, which is the 31st, you are all going to present to the school at 7 a.m. Make sure that you are in your scrubs with appropriate shoes per the syllabus. Also, please make sure to bring your supplies. If you have picked up your blood pressure cuff, stethoscope, all that stuff, bring it with you. And your workbook. Remember, put your name somewhere on this thing so that we can get it back to you. Workbook makes a good study guide for your final, so I would highly suggest getting it back. Other than that, your workbook is done, right? You don't have any more chapters to do in it. So what your homework is going to be going forward is just your modules. So you'll still have your modules every week. So make sure that you are still completing those. Remember that you do have a set of modules due today. 5, 6, and 7 are all due by tonight, 11:59 p.m. After you attend your clinical, so day 1 of clinical is orientation and your CPR hands-on portion. So you actually get to practice those CPR skills from the videos that we watched. You'll have your 2 weeks of clinical, and then after that, you will come back for your presentations. You'll log in. I'll watch you do your presentations. After that, you'll have makeup day in case you miss a day of clinical, and then you'll have your final exam. Your final exam is a month away, so no need to stress about it yet. It is 100 multiple choice questions. So just to give you an idea of what that will look like. That thing is still in the trash. Okay, I did send another message yesterday about it. So let me send uno más, one more, about the chapters, just the chapter module roadmap. Everything else I looked at looked okay. Anybody else see anything that said it was in the trash besides the chapter module roadmap? Oh, all right, I'll send another message on this. Hopefully we can get that fixed. I tried to go in and fix this stuff yesterday. A couple of them are already fixed. And then that chapter module roadmap, since I don't own the document, it wouldn't let me retrieve it. So I sent another message to the school to have that thing updated, get it back in there. I don't know what happened to it. It's weird. Sometimes Google changes the permissions on the documents and then stuff goes haywire, and I don't know what in the world happens in Google land, but it's frustrating. So I apologize for that. I sent over another message just now so that we can get the chapter module roadmap fixed. All right. So that is kind of what happens between today and the end of your class. Are there any questions on what to expect for homework, for clinical, for presentations? Anything, questions from any of our content the last 2 weeks? Anything at all? No? So everybody knows either if you missed a day, Tuesday, you're logging in for your makeup day. If you didn't, you have Tuesday off, and then everybody will be at clinical Wednesday, 7 a.m. If for some reason you're going to be late for clinical or you're going to miss clinical, you need to call the school and let them know. Otherwise, they're probably going to start calling you, wondering where you are. So make sure that you call, don't email or post in the classroom, just call the main line of the school. If you don't have any other questions, then the next time I will likely see all of you is for your presentations. So if you want to reach me, if you have any questions, post in the classroom. More than happy to answer your questions if you have some. You can also ask when you're in clinical. Everybody knows about pretty much everything that's going on in class and in clinical. So if you have those questions, feel free to ask them or post them and I can get back to you. I usually check the classroom. Try to check it daily, but sometimes it ends up being weekly because I do start another class for phlebotomy starting next week. So I will be teaching that class coming up as well. So I'll try to check as frequently as I can. All right. So everybody who was here this morning is still here. It doesn't look like Kylie has joined us. If you don't have any other questions, then you are free to go. Hopefully, maybe you can get your modules caught up on. Make sure you get 5, 6, and 7 turned in. And then you can enjoy your long weekend, Friday, Saturday, Sunday, Monday, and then maybe Tuesday if you didn't miss any days. So I will see you all on presentation day, which is like almost a month away. Enjoy clinical. Let me know if you have any questions. And I hope that you all enjoy your weekend.
Thank you. Bye.
You're welcome. I will see you all later. You're welcome. Yeah, Valerie, did you have a question?
For our badge photo, were we supposed to hear anything back or?
No, as long as you emailed it in, they'll have it ready for you on your first day of clinical.
And if for some reason it didn't go through or the pictures like showed in blurry, like they would email us that?
Yeah, if they got a picture that they could not use, they would definitely let you know.
Okay, thank you.
Yeah, you're welcome.